So I'm going to present interesting case number 1, and then Matt gets to present interesting case number 2. My disclosure is that I have no disclosures, but I have obtained both parental consent and patient assent to use photographs for this presentation. I'm presenting an 11-year-old boy who presented to our adolescent bariatric surgery program. He was born 4 weeks premature at 2.5 kilograms at birth. He gained about 1 kilogram a month for about 8 years and then progressively increased to gaining 3 kilograms per month until age 11. His weight at presentation was 145 kilograms, and that was about a year ago today. He turned 11 during our follow-up, and at 10 months before surgery, which was done in February, he weighed 175 kilograms and had a BMI of 60. He's a very active kid, as you can tell. He's been playing football and baseball for as long as he can remember. He swims and plays basketball also daily. He was in one monitored weight loss program that included an 8-week 800-calorie diet, which resulted in a 3-kilogram weight loss only, and he continued to regain that weight as soon as he stopped the diet. If you want to talk about genetic predisposition, this child was set up to develop obesity. His mother had severe obesity and underwent a biliopancreatic diversion, as did his father, both 2 grandparents and multiple aunts and uncles. His first cousin was planning a sleeve gastrectomy about 2 weeks after his procedure. Genetic testing had been done, and there were no evidence of any known genetic variants. He does have hyperphagia. He does describe constant hunger, and he did not have Prader-Willi syndrome. His comorbidities included diabetes, which he had had for 2.5 years when we met him. He was on metformin. He had an A1C of 6.3, which was rising. When he originally started the metformin, it had dropped to 5.7. He had hypertension on Norvasc, dyslipidemia, attention deficit, and he has mild autism spectrum disorder. He is fully verbal, but has some social issues. He is socially stigmatized and has significant teasing, especially starting the last 2 years. And he has been unable to play football for the last year due to his size. After a multidisciplinary team meeting, he was fully evaluated and followed for 8 months in our program. And you can see that during those 8 months, we were unable to curb his weight gain despite stopping all sodas, stopping all snacks, doing 3 meals a day, and literally being on a 1,000-calorie diet. He would not stop gaining weight. This is him on the day of surgery, and you can see from this graph that after surgery was done here, actually it was done here, he lost 7 kilograms before surgery on a strict like 500-calorie diet. He then proceeded to lose weight after surgery quite well so far. And this is him on his 12th birthday. He did have some mild complications. He had mild postoperative nausea, which resolved with a scopolamine patch. He had blood sugar, which were well controlled after surgery and after stopping metformin. His hypertension post-op day 1 and 2, I think, were related to pain, which resolved without restarting the Norvasc. And he did develop new onset Tourette's about 10 days post-op, which is associated strongly with autism spectrum disorder. And it was interesting, we started him on vitamin B6 and magnesium supplements, and the symptoms resolved within 48 hours, which is actually a well-described treatment for Tourette's. So just for your knowledge in terms of interesting cases. This is him a couple days ago. His mom sent me this new picture of him now, 2 months post-operatively, and you can already see that his hair is growing out and his size is decreasing. That's my case.
Okay. Thank you. That was a great case. It's fantastic.